Welcome back to HealthCare Consumerism Radio. This is your host, Doug Field, along with Brent Macy. And on this segment of HealthCare Consumerism Radio, we're going to take a behind-the-scenes look at, the administration of account-based plans. One of the leading technology providers in this business is Acclaris. And joining us is their Chief Growth Officer, Jim Priebe. Jim, good morning.
Hey, Jim, can you hear us?
Jim, can you hear us?
Yeah, hi, this is Jim Priebe.
Hey, sorry, Jim. Couldn't hear you there. Anyway, welcome to the program. Are you up in Minnesota today?
I am up in Minnesota today, and thanks for having me. We're excited in Minnesota because it's about 40 degrees and the sun is out, so that's a big accomplishment for us this year.
Well, Jim, it's 70 degrees and the sun is out down here. Sorry about that.
That's all right. We'll be able to hit the golf ball hopefully by June up here.
There you go, Jim. Listen, as I kind of opened up this segment, I mean, you're the behind the scenes, almost intel of helping make administrator happen around account-based health plans, and talk a little bit more about Acclaris's position in this space and what you guys do to enable health plans, benefit administrators, exchanges, et cetera. Effectively administrate these plans.
Yeah. I'll talk a little bit about that. Acclaris, our main focus in the marketplace is to enable our clients in the market really to transform the way they are out offering and administering consumer-driven health and reimbursement accounts. We feel that, our model between an integrated technology and service delivery platform is really unmatched in the marketplace, and really focused on a low cost of entry and maintenance costs to enable organizations to be in this space, and doing that through a private label process that then allows our partners and our clients to go out and leverage their brand and continue to leverage their brand, but provide the infrastructure needed, and to really, frankly, help them keep pace with the demands of the marketplace, both at the employer level and at the consumer level. Out there, as we know, it's ever changing, and the demand becomes greater and greater to keep those consumers more engaged in understanding how these programs work.
Yeah, and a big part of this is we were talking earlier on the first segment. I'm not sure you were listening, but HSAs have really come out in very good shape as far as fitting into these exchanges and their place in the marketplace. So you're probably
hey guys, I'm having some trouble hearing you.
Can you hear me now, Jim?
It's a little better, yes.
Yeah, what I was talking about is the health savings accounts themselves have come out very favorable from the law recently as far as their place in exchanges and their place in the marketplace. So you're probably being a recipient of that positive ruling, correct?
Yeah, you're still kind of breaking up a little bit, so I apologize for that. But if I heard what you were saying around the HSA growth and us seeing, positive traction there in that space, and yeah, definitely, we saw coming into 2013, good strong growth in the HSA product, through our various partners, and continue to see, quite a lot of interest in the marketplace around the HSA, and I would say also with that it seems to be very niche conversations around the HSA, retiree accounts, and also supporting defined contribution mechanisms today in the marketplace.
What's your position or what's your place at the table with exchanges?
Yeah, so for exchanges, we as we go out and back to our business model of enabling our clients to really transform the way they administer and provide these consumer-driven health and reimbursement accounts, our technology and our platform has really been designed around a robust set of rules that we bring together to create different types of plan designs, whether those are HRAs, whether those are HSAs, FSAs, or incentive accounts. So being able to support an exchange entity that drives strong decision-making capabilities and supporting them from managing contributions, sorting through all the different aspects of what those contributions could look like, whether those are coming in the form of employer contributions, employee subsidy, managing that, putting those contributions into some type of rules configuration that says here's how those disbursements and what's going to be eligible for disbursements. So behind the scenes, supporting them and providing those decision support tools and engines out there in companies to provide a robust, scalable platform to be able to handle that volume and make the integration points happen. And then with that, we're also seeing a lot of activity from these organizations that want to bring more services to bear to their clients and to their customers. And with that, then, in our business model, we're able to quickly put them in the business of offering FSA accounts, offering HSA accounts, and other types of things in their brand and their products. So, one, supporting them from the backside engine standpoint of managing contributions, reimbursements, and providing that strong infrastructure for them. And then, two, enabling them to be in the consumer-driven health and reimbursement business as they see fit.
What's that sounds like that sets you apart from some of your competitors. What are some of the other unique differentiators with the Acclaris model?
Yeah, well, we do believe that sets us apart, and we believe that sets us apart because our focus is to enable our clients and drive them to the success they're going to have, and I think that's one of the things that sets us apart. The other key things that really set us apart from that perspective is, the way our business model has been built, and as we see the demand for these account-based plans continue to be greater and greater, and you're seeing health plans and financial institutions, benefit administrators, the exchange organizations we just talked about, brokers, consultants, figure out that they have to have a scalable, robust solution. It isn't about just swapping out technology anymore. It's about enabling them to do this better, which means bringing a combination of technology and services to the table. And, when we were founded in 2001, and the vision was to have an integrated platform to bring the efficiencies to bear around how an operation and service from claim reimbursement to treasury management functions, how those play into the overall technology platform, the experience, has served us well in today's market, because we can quickly bring a technology solution along with service solution at a full service capability if needed in a private label manner, and enable these entities to be in the business tomorrow with all of the feature and functions they need out there to be very competitive in today's world.
Jim, one of the things that we talk about is the healthcare law. With your business, what are the do you see any further opportunities for your business underneath the healthcare law? Do you see things that you might need to work through with provisions underneath the healthcare law?
Yes, absolutely. We know we're not exempt from the healthcare law and the things that we need to work through, much like probably every organization in this space today, right?
Right.
But we see there's a lot of great opportunity, and we see that because as we look at the healthcare law and we look at some of our clients and our partners in the marketplace, and where they may have different challenges than we do today, example being a health plan who has to really focus on cost and efficiency and where they're going and how they're investing and spending dollars, yet they also have this growing demand and population for CDH. Where do they put dollars? And we think our business model serves them well because we can snap in quickly at a low-cost entry point, provide the services, deflect some of those dollars that they would have to invest and put into CDH and reimbursement accounts. They can put those back in. The savings we can bring to the table will help them overall with their MLR calculations and the things they need to do there. And with that, I think also just continuing to keep pace and stay involved with the healthcare law. As you know, we're all not done with this, and there'll be continue to shape and drive that. So, we take an active role in making sure that we're out there representing our clients' best interests as well as our business's interests and overall the industry's interests of how we keep these things moving in account-based plans.
Jim, excellent. I want to give you a chance. We've got about a minute to go here. Time flies when we're having fun. But,
yeah.
Give our audience some takeaways that you'd like to leave them with, please.
Yeah, thank you. And I would say the takeaways I'd like to really leave the group with is, there's a great opportunity out there in this space, and many organizations really stand to profit from the trend in consumer-driven health and reimbursement products. if they can find a way to acquire infrastructure and expertise needed to administer these plans without a large capital outlay, we think there's going to be a lot of good things in growth that can come not only from potential growth of their business, but also the industry. And when we do that, that strengthens our industry, strengthens the value of these products, and makes it harder to make changes and do away with them at a legislative level. And so our services and the things that we're focused on is just that, is helping these entities be strong in that space, making these products viable, and continuing to push through them, and really supporting the health plan, the financial institution, the benefit administrators, and that health exchange market, bringing that technology and services to bear so they can go out there and generate revenue and grow their businesses as well, and focus in a core space they need to focus in, and let that burden come back to Acclaris to drive that CDH and reimbursement products.
Well, Jim, I really appreciate you being on the program today, and enjoy your weekend in Minnesota. And to our audience, you can join Jim and his team at IHC Forum East in May. Stay tuned. We'll be back with the next segment of HealthCare Consumerism Radio. Thank you.